Hi, Assalamualaikum to our lecturer, Dr. Abdul Mujib. My name is Maizatul Alia binti Jafridin, and I will be the first presenter for my group. And our topic is emotion. So, as a first presenter, I will talk about the introduction. What is emotion? Emotion refers to behaviors, physiological responses, and feelings. Refers to positive or negative feelings that are produced by particular situation. Most of us use the word emotion to refer to the feelings, not to the behavior. It is behavior that has consequences for survival and reproduction. Emotions as response pattern. An emotional response causes three types of component. The first one is behavioral, the second is autonomic, the third one is hormonal. The behavioral component consists of muscular movement that are appropriate to the situation that elicits them. Second one is autonomic responses facilitate the behaviors and provide quick mobilization of energy for vigorous movement. The activity of the sympathetic branch of the autonomic nervous system increase while that of the parasympathetic branch decrease. The third one is hormonal. Hormonal is a response that reinforces the autonomic responses. The hormone secreted by the adrenal medulla and pinevrine and norepinephrine further increase blood flow to the muscles and cause nutrients stored in the muscle to be converted into glucose. In addition, the adrenal cortex secretes steroid hormones, which also helps to make glucose available to the muscle. Neural control of emotional response patterns is the role of the amygdala. What is amygdala? Which is that, as you can see, the stimulation can produce the behavior associated with anger or fear. To overt behavior, the autonomic responses and then hormonal secretion associated with this emotional reaction and controlled by separate neural system. The integration of these responses appear to be controlled by the amygdala. Researchers in several different laboratories have shown that single neuron in various nuclei of amygdala become active when emotionally relevant stimuli are presented. The amygdala is involved in the effects of pheromones or reproductive, physiological, and behavior. The amygdala is located within the temporal lobes. It consists of several groups of nuclei, each with different inputs and output, and with different function. The major parts of amygdala are medial nucleus, second was the lateral or basolateral nuclei, the central nucleus, and the basal nucleus. In addition, emotional responses. The central amygdala is particularly important for emphasize emotional learning. A conditional emotional response is produced by a neutral stimulus that has been paired with an emotion-producing stimulus. Briefly, classical conditional occurs when a neutral stimulus is regularly followed by a stimulus that automatically evokes a response. If the organism learns a successful coping response, a response that terminates, avoids, or minimize an adverse stimulus, the emotional response would no longer occur. So that's all from me, and I will be pass this presentation to my second presenter. Thank you.
Assalamualaikum and hi, my name is Auni Atika binti Idris and I'll be presenting about my part, which is communication and emotion. Communication and emotion are being divided into two, which is nonverbal and verbal. For nonverbal, it is shows by using our facial expressions, and for verbal, we are using vocal, and it is one of the most effective in describing emotions. Okay. Nonverbal is one of integrative embodiment theory of emotions that they maintain that bodily sensations are a critical component of emotions, but the perceptions must be integrated with cognitive information. For example, to produce an angry expression, the subjects will need to be told to pull their eyebrows down and together raise the upper eyelid and push the lower lip up with the lips pressed together. It is also same for happiness, fear, anger, disgust, sadness, and surprise, which each resulted in the experience of the intended emotion along with a distinct pattern of physiological arousal. For verbal, human voice is one of the principal conveyors of social and affective communication in expressing emotion. Neural circuitry that supports the recognition of different vocally expressed emotion. fMRI study has been conducted by researchers which to examine the brain responses to vocal expressions of anger and happiness, which to test whether specific brain regions showed preferential engagement in the processing of one emotion over the other. After the study, it shows that happy voices have more activation than angry voices in right anterior and posterior middle temporal gyrus (MTG), left posterior MTG, and right inferior frontal gyrus. For the left MTG region, happy voices were related to higher activation only when showed with happy faces. That's all for me. Thank you.
Hello everyone. Today my topic is emotion, feeling of emotion. First sign, as happiness or pain and constructed the psychological contact of emotion. Emotion is a psychological phenomenon mediated by the need and wish of the subject. In line with the need and wish of the subject, it will cause positive and positive emotion. On the contrary, it will cause negative and negative emotion. Each emotion has different subjective expressions, which represent different feelings of people, such as happy. People express their emotions through a variety of behavior. Facial expression is the most directly embodied. People express their emotion with a variety of behavior. Facial express is the most directly embodied. Sometimes most sometimes more complex emotions are reflected in body posture and movements. Sometimes it is difficult for language to express emotional express accurately, but this stuff can smooth your skin, and at the same time it can weaken your emotion, according to the new study. Next slide. Paul, a psychological at the University of California, San Francisco, has found that there are has found that there are has found that there are needed a few core emotions in human beings. And Ackman points out that there are four basic emotions of human beings are joy, anger, sadness, and fear.
Assalamualaikum and hi, my name is Nurul Syafiqah Syazwani binti Kamar Zaman, and now I will explain about aggression. So what is aggression? Aggression is a behavior that intend to do harm. Aggression in human is much more complex than animals. So in humans there are two types of aggression that we can see. The first one is instrumental aggression and the second one is impulsive aggression. So, instrumental aggression is unprovoked and emotionless, while impulsive aggression occurs when we respond toward a threat. So, next we will see about what is the relationship between emotion and aggression. According to Mr. and Bushman, emotions are an essential part of the psychological causes of violence and aggression, meaning that emotion plays a part in aggressive behavior. The meaning of emotion is a state of feeling and aggression is a behavior. So the connection between aggression and behavior include connections between objective acts and subjective emotions. Now we will see what are the organ, hormone and neurotransmitter that are related to aggression. So the first organ that are related to aggression is hypothalamus, and the neurotransmitter related to aggression is serotonin and cortisol, while hormone related to aggression is testosterone. So hypothalamus is a primary neural instigator of aggressive behavior, and serotonin plays a crucial role in inhibiting the prefrontal cortex that exerts on aggression, while cortisol is released in response to stress and to help the body cope by regulating many of the changes that occur, such as blood pressure, blood sugar, and immune response. And the role of testosterone in aggression is controversial because some observers argued that elevated testosterone is the result of aggressive behavior, not the cause of aggressive behavior. So next, we will look into a study done to see what are the relationship between testosterone and aggression. So for this study, they found out that there are no relationship between testosterone level and aggressive behavior. However, there are many other studies where they found positive results on the relationship between testosterone and aggression. Some are negative results. So therefore, we can conclude that the relationship between testosterone and aggression is non-linear. So that's all for me. Thank you.
I'm Sabrina Alwani and I'm going to explain about the stress, immunity and health. Stress is a term that has two meanings in psychology. Stress is a condition in the environment that make unusual demands on the organism, such as threat, failure or bereavement. Stress is also an internal condition we respond to a stressful situation. For example, you feel stressed and your body reacts in several ways. Whether a situation is stressful to the person is often a matter of individual differences, either in perceptions of the situation or in psychological reactivity. Stress in this sense of the term is in the eyes of the beholder. Stress as an adaptive response. Ordinarily, the body response to a stressful situation is positive and adaptive. Stress activates the hypothalamus pituitary adrenal axis, a group of structures that help the body cope with stress. The hypothalamus activates the pituitary gland, which in turn release hormones that stimulate the adrenal gland to release the stress hormone epinephrine, norepinephrine, and cortisol. The first two hormones increase output from the heart and liberate glucose from the muscles for additional energy. The hormone cortisol also increases energy level by converting protein to glucose, increasing fat availability and increasing metabolism. The immune response involves two major types of cells, leukocytes or white blood cells, recognized invaded by the unique protein that every cell has on its surface and kill them. Natural killer cells, the second type of immune cell, attack and destroy certain kind of cancer cells and cells infected with virus. They are less specific in their target than T or B cell. The brain and spinal cord are considered immune privileged, in that the central nervous system is protected from most infectious agents by the blood-brain barrier. Some antibodies are transferred from mother to child during the prenatal period or postnatally through the mother milk. Most antibody result from a direct encounter with invading cell, for example, during exposure to measles. Vaccination work because injection of a weakened form of the disease-causing bacteria or virus triggered the B cell to make antibody for that disease. Negative effect of stress. Chronic stress can interfere with memory, increase or decrease appetite, diminish sexual desire and performance, deplete energy and cause mood disruption. Stress increase blood pressure and prolonged high blood pressure can damage the heart or cause a stroke. Stress can even produce death. In sudden cardiac death, stress causes excessive sympathetic activity that sends the heart into fibrillation, contracting so rapidly that it pumps little or no blood. Extreme stress can also lead to brain damage. The abused individual had short-term memory deficit, and some of the torture victims show slight intellectual impairment. However, individuals with PTSD have lower cortisol levels. Several studies suggest that reducing stress can improve health. At any rate, it may be more practical to block stress hormone and bolster immunity chemically. Social personality and genetic factor. But people who have hostile are at greater risk of heart disease, while cancer patients who have a fighting spirit may live longer than patients who accept their illness or have an attitude of hopelessness. Social and personality influence must work through psychological mechanisms which unfortunately are seldom assessed in this study. An exception is an investigation of individual differences in immune response. Personality characteristics such as introversion are moderately heritable, and so is vulnerability to stress. One gene implicated in stress is NPY, which encodes the production of neuropeptide Y, which you know from its involvement in appetite. People with a low-functioning version of the gene show greater brain activity in response to negatively charged words, report more negative feelings in anticipation of a painful stimulus, and are more prone to depression. Besides playing a role in sexual experience and bonding, oxytocin increase during stress and reduce some of the psychological effects, including blood pressure and heart rate. Stress effects are known as sometimes carry over to the offspring, apparently due to epigenetic change of this sort. Based on the research made by Casey Mora, a technique that can help with the management of stress is meditation. In the management of acute stressful tasks, showing that the slow breathing technique can have a significant effect on improvement of the hemodynamic change following the acute stressful task. So that's all from me. Thank you.